Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry. Hello, everyone, and welcome to this week's episode of the Barrier Breakdown. My name is Erin Melano-Bailey. I'm the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner, also at Cognitive Behavior Institute. So this week, we are very excited to be joined by State Senator Judy Schwank, who represents Pennsylvania's 11th Senatorial District, including the city of Reading and many of its surrounding boroughs and townships. Since her appointment in 2011, Senator Schwank has worked across the aisle to champion issues that directly affect women and children. So, Senator, thank you so much for being here with us today. We're very excited to have you join us.
Thank you. I'm excited to be here too.
And I think it would be great to kind of start the conversation so we can learn a little bit more about you. And could you share with us and our listeners what led you into politics? What led you to be excited and interested in public office?
Well, it certainly wasn't a lifelong goal. I sort of eased my way into it. My degree is in agriculture education, and I worked as a county extension agent, meaning I worked with adults in horticulture, helping them learn about raising vegetables and fruits on a commercial and on a home basis. So, I started doing some work in community development, like working on helping folks determine if their water was safe to drink, and working on issues like, landfills and their impact on a community. And I thought to myself, this is what I really love, is working on these issues with people, and rather than just talking at them, but being with them on the front lines to work on issues. So I decided one day, somebody said to me, well, why don't you run for office? I laughed. And then an opening came up in the county commissioners in my county. And I decided to run, got a hearty band of volunteers to help me. And that's how it all started for me.
Wonderful. It sounds like you are really passionate about helping people. That's a wonderful quality and something we all admire. Can you share with us how you became interested in youth mental health?
Well, certainly as an educator, and I was also a high school teacher as well. So I've had long, interest in how our youth and, particularly younger kids are adapting to the world that we live in right now. As a teacher, I can recall having students that really didn't have a place to go after school or didn't have the kind of home life that I grew up with. And I saw these problems manifest themselves in how they learned in school. So obvious. Kids they are what they are, and they're very open and honest for the most part about their feelings. And so way back then, even, I recognized that, kids face the same issues that adults do in regards to mental health. So that's kind of how I've come about this, and I have always been interested in it. Now with the pandemic and the information that I'm receiving, from teachers, even the past 16 months as we, went into virtual learning, or in many cases didn't even have school for some kids, learned a lot more about some of the issues our kids are facing.
There's similar things here in behavioral health. We're hearing a lot of the behavioral health struggles of whether it be inability to just cope because of the new framework of learning, stressors of the parents having to have the changes in their lives, whether it's economic, can't get to work, how do you work from home and teach at the same time? It's been quite the struggle. So I can appreciate you kind of having vigor towards this issue. Can you speak more about Senate Bill 506? And kind of, what's behind it? What do you think is so important about it?
Well, the premise of Senate Bill 506 is that it would allow students K through 12 to have 2 days per year as mental health days. So if you needed a day off to take a break, you wouldn't have to put on your excuse, Johnny had a stomach ache, like my mom might have done, or your mother, when she gave you a day just to step back a bit. And I did that. I feel it's important to recognize it as mental health days because that is as important as physical health. In fact, I think the two are so intertwined that I don't think that you can necessarily separate them. But it's important to be upfront and honest about it. We're seeing more and more of this in the public, right? With public figures coming out and saying, I just can't do this because this impacts me and the way that I feel. So that's certainly was a reason behind it. But then I had a student, and who is now my intern, a high school student, who came forward to me, and funny, at the same time, we had both been looking at this legislation that had been passed in the state of Colorado. And he asked me, would I introduce something like that? And I said, yes, immediately. And so it's been kind of a great relationship. We've gotten the bill introduced, and I'm hopeful to get it considered in our education committee in the Pennsylvania State Senate.
You know, it's funny that you bring up Colorado. We actually had a podcast earlier this year with Representative Daphna Michelson-Janae. I'm not sure if you two are familiar with each other, but
I recognize the name. Yeah,
she spoke to us regarding some, legislation that she was pushing about mental health evaluations for kids, before they return from the pandemic, so that, you could screen out who is suffering from what, and in some really forward thinking, some really good ideas. So it kind of sounds like Colorado really has it together on the mental health front with legislation, and we're hoping, PA can follow suit.
I absolutely agree with what they're doing. And I think most recently, Colorado has declared that there is a mental health crisis among children and youth. Just that kind of recognition. And I believe the Children's Hospital has also been, engaged in those discussions as well. There's just acknowledging the fact that this is an issue is a very first step, I think.
I think that acknowledgement also will help reduce the stigma, which everyone is always, that's such a key phrase, reduce the stigma of mental health. But I think, this really shows when you say about the truth, you don't have to lie that, you were sick or you had a stomach ache or, something of that nature. That really helps to normalize the mental health struggles that people can face. And it also teaches our kids that it's okay to take a step back. Do you agree with that?
Absolutely, I agree with it. It's okay to acknowledge that everything's not always perfect. And even for those students, and I talked to a couple that, AP classes, sports, after school jobs, social clubs, all these things that they're engaged in, sometimes they're just exhausted. And they look on the surface to be, those kids that every parent wishes they had, but things aren't always okay. That sometimes they may be hiding feelings of, depression, inadequacy, or that they don't measure up, that it's hard on them. And so you don't just have to look at the kids that are, not responding in a classroom, let's say, but even the ones that seem to be the perfect students may also be suffering from, just a need to rest.
How much support do you have? I know this is a big swing that we have with the pandemic and our way of thinking. To think about 2 extra days, I know oftentimes funding and how many kids are in school and how often they're there fits into that. What are you hearing from constituents and beyond?
Well, from constituents, certainly there has been a mixed bag of reactions. A lot of adults, when we posted this on Facebook, and the interaction that we got was, oh, suck it up. I walked 5 miles to school, that kind of thing. In the good old days, we didn't suffer from things like that. But then when you push back gently and say, didn't you just take a day off just to go golfing? Didn't you just take a day off to, go to the park, or you just didn't go to work because you just couldn't face it that day? Kids have those same kinds of feelings. And when you explain it to people like that, they're a little bit more receptive. I've talked with guidance counselors who say, this is how or school counselors, as we call them, have said, we talk a lot about self-care. This is a way for us to walk the talk, to actually support parents and students in recognizing the need for students to take that break. And I'm glad you brought up the point about being in school. I have worked on a legislation regarding truancy. It's been a huge issue for us in the community that I serve, as a matter of fact. And what we found talking with teachers and our task force that worked on truancy, many times kids start missing school, not always, but sometimes just because they are facing issues of bullying. They are afraid to talk to other people or their teachers, that they're falling behind in their work. And once they start missing days, they keep, it gets into a cycle, and they lose even more ground in terms of academic progress. We found that we had to make some changes in terms of how we handle truancy policy in the entire state. We changed the law. And this, I think, relates exactly to this. Even though I'm an advocate for kids not missing school, I recognize that there are important reasons for kids to be out of school. We should acknowledge it.
No, that's very true. You bring up a good point, and I'm glad you brought up the truancy, because I'm sure there's lots of other bills and other legislation that you're also working on. Could you share with us some of the other issues that you're passionate about, whether they're mental health related or otherwise, that you're currently working on next?
Well, I'm very interested in the issue of tuition equity for all of our students. We have a number of students who are the Dreamers or DACA recipients that are in our community. And so they sometimes find they have to pay a higher tuition than other students. I believe that every student should be on a level playing field in terms of that. I've been very engaged in the issues of maternal health, infant health, making sure that we screen babies for, the mothers with depression, so that we're able to give them additional services right at the get-go before serious situations develop. Home visiting has been an issue that I've championed a lot, so that we have nurse-family partnership that goes into homes, helping young mothers or mothers and fathers in terms of raising their children. So it's all encompassing for me. Even though my emphasis, the committee I chair is agriculture, this is a real passion for me.
Yeah, I can appreciate kind of the multiple dynamics of maternal health. That's so important because it's going to be very impactful to that child growing up, as well as the mother.
Right.
And clearly, mothers are kind of, we have them at a higher standard, right? Because if it wasn't for moms, we wouldn't have society. On top of that, kids' health. And one of the things with pandemic, and you talked about access, getting into the homes, one of the bridges for that has been technology, particular virtual therapy. And it has been very strong for us. And I know what has come up very recently is lots of anxiety from both the consumer side as well as the provider side, because we feel we don't have guidance on what's going to happen when a state of emergency lifts, and be able to continue services. Particularly, I can say for ourselves, we're treating people in Reading, even though we're in Western PA, because there is no access to psychiatry. We have psychiatry or therapy, but suddenly we feel like we're going to have the rug pull out from under us. What can you speak to that issue? I'd really appreciate what you see going on and how we can address it, and then talk a little bit more how we can team up to advocate to make these changes.
I'm really glad you brought that up. Kevin. Just today in our session, in the Pennsylvania Senate, we voted to end the emergency declarations. Now, while the voters had already done that through the constitutional amendments that were voted on, that they made that decision, we were able to at least include some of the waivers, so that, for example, telehealth would still be available until the emergency declaration ends, which will now be, I believe the date is June 10th. So it's not September 30th. So I'm very concerned about what that means. We really need to pass a bill to authorize telehealth in Pennsylvania. And offer the full scope of services in terms of telehealth. We haven't been able to do that yet, but I'm hopeful when we return to session, we'll be able to get that done. I understand what you're saying. I have dealt in addition to that, it's even in terms of reimbursing providers for mental health care. I have met with pediatric practices that employ, a specialist to deal with mental health issues with children. And the reimbursements that they're getting from insurance companies are pitiful. They're pathetic. Like, I've looked at bills where they got 99 cents as a reimbursement for spending time with a child for counseling. It's deplorable. It really is. And we're working on that.
Yeah, I'd like to hear if you are aware of any legislation, how we could support, because I know PA is probably one or two, last time I checked, of the only states that don't have legislation specifically for telebehavioral health. There is sometimes this, at least prior to the pandemic, I don't know about now, about lack of parity and reimbursement, as you described. If I were to see you in person, it would be one thing. If I see you virtually, it would be something else. Or certain insurances, because there weren't a law, would not allow for reimbursement for telehealth. And what's going to happen? Pandemic's over. The ramifications of the pandemic are just beginning, and this is a real issue. So, is there anything currently pending? Is there anything we can be helpful as a community to you?
There are a couple of bills that have been introduced on telehealth. Of the numbers, I'm sorry, I just don't have in front of me, but I can make sure that I get them to you, or you can research them on the state website. But there are bills there. It's just getting them considered and passed both in the Senate and in the House. Seems to be a breakdown in what we pass in the Senate versus what the House is receptive to.
Are you aware of any barriers to those legislation? I know they've been coming up year after year. What's been sinking them, if you're aware of any?
I can tell you that at least in one case, the issue was that there was a prohibition of allowing, now this is in general telehealth, a reproductive health care for women was banned from the bill. And so that was kind of a deal breaker for a lot of legislators, including me, because everything should be available that is feasible in terms of telehealth, mental health, right?
Correct. Yeah. Well, I appreciate that. I appreciate all your efforts. It's greatly appreciated.
Thank you.
Yes. And just before we finish up, so that we can end on kind of a fun note, we learned that you worked, like you had mentioned, as the Berks County Horticultural Agent for the Penn State Cooperative Extension and established the Master Gardener program. So we know that time outdoors and gardening can be a great tool for mental health. Do you have any gardening tips for our listeners who may be home gardeners this summer that you'd like to share?
Absolutely. I and you can solve the problems of the world if we just spend an afternoon weeding. Just being outside and, working at a task. When you're gardening, you're helping first of all, you're out in the fresh air, right? Or out in the elements. You're watching things grow. It is so restorative. I can't emphasize enough how important that is. So when I take my mental health days, Erin, you might find me in my yard or in my vegetable garden. I have way more gardens than I probably should have. But every day, even in the morning, sometimes before I go to Harrisburg, I will walk outside just to look at, this sprouted. I got to pick this, or there's weeds. It's just so rewarding.
Wonderful. Well, thank you so much for being here with us today. We hope to stay in touch with you, and we hope to continue to see some improvement and advancement in the bills that you present, especially 506 with the mental health days, as well as some others, so that hopefully we can continue to bring services through telehealth to Pennsylvanians who surely need them all across our state. So thank you so much for being with us, Senator Judy Schwank. We appreciate it.
No, thank you. I enjoyed the conversation.
Wonderful. And thank you so much to our listeners of the Barrier Breakdown. We hope you enjoyed today's episode, and we hope that you all stay safe and healthy. Take care.
Thank you for listening to the Barrier Breakdown, Disrupting Mental Health. Listeners can find all of our episodes on YouTube, Apple Podcasts, Spotify, and Podbean. For more information and to learn about upcoming continuing education events, check out our website, cbicenterforeducation.com, our Facebook pages, Cognitive Behavior Institute and CBI Center for Education, as well as our Instagram at Cognitive Behavior Institute and our Twitter at CBI_Pittsburgh. Don't forget to like, comment, and subscribe. We hope you'll tune in for another guest next week.